Hola a todos, muy buenos
Good
días.
morning, good afternoon, and thank you for connecting to this press briefing organized by the Pan American Health Organization on the COVID-19 pandemic in the Americas. My name is Sebastián Oliel with the Communications Department at PAHO, and this session, as every week, will be about an hour long. As you know, we have already received your questions via email, and you will also be able to ask your questions live through the chat by using the Q&A button. Please do mention your name and media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, and French, and that you can choose the language by clicking on interpretation. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the evolution of COVID-19 in the region of the Americas and about the situation and the challenges faced by the indigenous peoples in the Americas. Together with Dr. Etienne, today we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies with PAHO, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19 at PAHO. Now, I would like to invite Dr. Etienne to share her update on the region and COVID. Dr. Etienne.
Good morning, and thank you for joining today's press briefing. Over the last week, more than 1.2 million COVID-19 cases and 20,000 COVID-related deaths were reported in the Americas. COVID infections are accelerating in North America, driven primarily by a surge in cases in the southern and eastern United States and in central Mexico. And in Central America, Guatemala is reporting a rise in COVID infections, particularly among people younger than 50. Cases are also on the rise in the Caribbean, where Cuba, Martinique, and the British Virgin Islands are continuing to see an increase in new cases. Meanwhile, cases are dropping across South America, although some Brazilian states have seen an increase in infections. This underscores the fact that until we effectively contain transmission, infections can surge quickly. So masks, social distancing, and other public health measures remain crucial. Unfortunately, this week, we also mark another grim pandemic milestone. Over 2 million people in the Americas have died from COVID-19 complications. That's roughly the population of Houston, Texas. This loss hangs heavy in our hearts, and it is a distressing reminder that we must act urgently to prevent further suffering. Today, vaccines, which are a beacon of hope to control this pandemic, remain out of reach for far too many people in the Americas. Just 18% of people in Latin America and the Caribbean have been fully vaccinated against COVID-19. While this pandemic has impacted all of us, today, I wish to spotlight the challenges facing our indigenous communities. The Americas are home to more than 62 million indigenous peoples that represent a rich fabric of languages, culture, and societies. And while each group is unique, no matter where you look, our indigenous communities are more vulnerable to COVID infections. Nearly half of indigenous peoples live and work in urban centers and travel back and forth to visit their families and communities. Many of them live in communal societies that make practicing social distancing and isolation very difficult. Together, This frequent movement and gathering creates opportunities for COVID to spread. Although we lack robust data for all Indigenous communities, based on the data that we do have from countries like Brazil, Colombia, Ecuador, and Peru, at least 617,000 Indigenous people have been infected with COVID in the Americas, and nearly 15,000 have died from COVID complications since the start of the pandemic. It is likely that many more have been infected and many more have died, but we may not know it because they have struggled to get the COVID care that they deserve. Many of our Indigenous peoples live in remote and isolated areas where a clinic or a doctor may be many kilometers or days away. Even those who live in urban centers still face invisible barriers like language, stigma, and poverty that can keep healthcare out of reach. We've long said that the pandemic has exacerbated inequalities in our region, and this is especially true for our Indigenous peoples, since most lack the financial and social safety nets to ensure that they can continue to provide for their families and communities even when they are sick. As countries continue to be challenged by COVID-19, we call on them to prioritize the needs of our Indigenous peoples. We are pleased to see that 17 countries across our region have listed Indigenous peoples as a priority group for COVID vaccinations, and vaccination campaigns are already underway. So far, more than 134,000 Indigenous people have been fully vaccinated across Guatemala, and more than 312,000 have completed their COVID-19 vaccinations in Brazil. But we unfortunately don't have data from every country. And that is why we urge countries to collect more and better data in disaggregated format to understand and resolve the challenges that are facing our Indigenous groups. Data is essential to guide effective policies. Too few countries collect data on the pandemic's impact across ethnic groups, leaving ministries of health blind to important and valuable trends on how the virus is affecting our Indigenous communities. In places where there has been robust data, like Brazil and Colombia, this has made all the difference in tailoring culturally adequate responses to the specific needs of Indigenous groups. This should be the rule and not the exception. To adequately address the needs of our Indigenous peoples, we must ensure that our strategies are designed by, for, and with the communities they are intended to serve. Countries must engage Indigenous groups as they design pandemic policies and adjust their COVID responses to ensure that they align with their needs and customs. PAHO has worked closely with organizations that represent Indigenous groups in our region, like FILAC, the Fund for Development of Indigenous Peoples of Latin America and the Caribbean, and COICA, the Coordinator of Indigenous Organizations of the Amazon River Basin, to issue culturally appropriate recommendations to countries across our region. PAHO has also been supporting a cross-border vaccination campaign to reach Indigenous communities in the Amazonian regions of Colombia, Ecuador, Peru, and Bolivia, where we've seen the importance of intercultural dialogues to build support for COVID vaccinations. And finally, countries must expand access to health, especially during a pandemic. Indigenous communities have long understood that the best way to provide care is by making it available within their communities, where it can reach the needs of more people close to home. As countries expand their healthcare capacity, they must ensure that health workers are sensitive to the needs and the languages of our indigenous communities, and that they respect the tradition of ancestral medicine, which is still practiced by many of our indigenous populations. As we commemorate the upcoming World Indigenous Peoples Day, we are reminded that for many of our indigenous peoples, the right to health remains a promise unfulfilled. As we continue to be challenged by the pandemic, we must ensure our responses and our COVID vaccination campaigns do not widen inequities that have long plagued our region. Instead, we must use this pandemic as a lesson that we cannot afford to leave anyone behind. Thank you.
Muchas gracias, doctora.
Thank you very much, Dr. Etienne. Now we are going to move on to addressing your questions. The first question that we have received is from Royston Jones from Eyewitness News in Bahamas, and in English it reads.
Recorded over 2,100 cases in July, and the vaccination program has stalled because of delays with vaccines. What does this mean for the country, and how can the Bahamas get more vaccines quickly? Dr. Barbosa?
Thank you for this question. It's very important that the Bahamas and all the other countries, they needed to work on these two very important pillars that working together can prevent the increase of in the number of the cases. They need to keep all the public health measures. They need to communicate with the population that is very important to keep wearing masks, to avoid the crowded, the closed spaces, all the public health measures that we know are very effective to protect against the transmission. Secondly, it's very important also to increase the population that is being vaccinated. The Bahamas has so far around the 11% of the population with the fully vaccinated. It's important to increase. The Bahamas received yesterday 33,600 doses delivered by the PAHO's revolving fund on behalf of COVAX. PAHO's revolving fund is now also negotiating with the country and the producer, Pfizer producer, to establish the date to deliver another 57,000 doses. And also the PAHO's revolving fund is working with the United States government and the Caribbean Public Health Agency, CARPHA, to facilitate the donation of around 4 million doses from August to November from the US to the Caribbean countries. So these are some of the alternatives that we are working together with the Ministry of Health of the Bahamas to increase the access of the population to vaccines. Thank you.
Muchas gracias, doctor.
Thank you very much, Doctor. The next question is by Chris Vilches, a journalist with Zona País of the Grupo El Comercio in Peru, and he's asking, what evidence do we have in connection with Lambda, since it continues to be prevalent in more than 70% of the positive cases to SARS-CoV-2 in Peru? And according to the National Health Institute, it is also responsible for the second lethal wave of coronavirus in the country. He's asking whether Lambda is more infectious than the Delta variant and whether the individuals that have been affected by Lambda have antibodies given Delta. Thank you for that question. It is important to mention that WHO considers variants in two groups of high concern and group of interest. Lambda is a variant of interest, and Delta, as the journalist mentioned, is a variant of high concern. In Latin America, the detection of the Lambda variant of interest has been sporadic in the various countries, with an increase in community transmission, in particular in Peru, where it reached 44% 6% in the sequences that we saw in the month of October, and in Chile, where it was detected in more than 30% of the samples sequenced between May and June. In Argentina and Ecuador, Lambda was also detected in the community, but that variant did not have an important impact on transmission. Other variants, such as Gamma, are more frequent. So far, there is no evidence that allows us to infer a more aggressive or more severe behavior of the Lambda variant, but it is likely that it may have enhanced transmission capability. This phenomenon has not been documented sufficiently. Therefore, it is not feasible to compare these to other high concern variants such as Gamma and Delta. This is one of the variants that has the highest circulation in the country, so it is to be expected that lethal and severe cases are associated to this variant. It is important to remember that the epidemiology of the virus and also the increase in the number of cases have to do with several factors, and not only the capability for transmission that the virus has. Therefore, we should insist, as we do on a weekly basis, that the efforts to control the epidemic need to be focused on an attempt to diminish transmission regardless of the variant circulating in a country or within a country's region, by using all of the tools available that have proven to maintain the efficacy, including the proper use of masks, social distancing, and clearly access to vaccines, which so far show effective cross-protection against the variants circulating globally and regionally. I hope I have addressed the concerns expressed by the journalist. Thank you. Thank you very much, Doctor. The next question is by Hector Rendon from Revista Factor RH in Mexico. What should Mexico do to contain transmission, in particular in touristic areas? Dr. Ugarte, thank you very much, Hector, for this question. This also applies to several countries that have opened up their borders to tourism and that are reopening the economy. In the case of Mexico, but also in the case of other countries, it is very important to intensify the communication on risk, public communication, and this should be for national and foreign tourists, and also the local population in destination areas, as to the measures of public health that should be implemented at all times in connection with the status of the pandemic. It is also necessary to increase the number of individuals vaccinated in that area so that the risk for severe cases and hospitalization may be reduced among the local population and clearly in the tourism sector. It will also be highly beneficial to guarantee that all of the workers in the tourism sector be properly informed and trained to be able to protect themselves, to manage risk in the areas where they work, and also protect the tourists. These are very important aspects because clearly with the emergence of new variants, but also the arrival of new individuals from other countries where it is difficult to determine the level of transmission from the moment the tourist left his or her country, it is important to increase epidemiological surveillance, also to confirm that health services are available and that tourists and also individuals in the tourism sector know what clinics they have. They can even establish telephone contact or have access to the health services, and finally adjust the measures based on the dynamics of transmission in those destinations, and in particular for those destinations. And so this is not a measure that is open to all destinations. It has to be specific to the place where those measures are being implemented. Thank you. Thank you, doctor. Now I would like to, I apologize. The next question is also related to Mexico, and this is by Manuel Lino from Eje Central, and the question is the following. In Great Britain, infections are increasing in children beyond what they saw during the first wave, and he's asking whether there is indication that Delta may cause disease that is even more severe than in this or in other age groups. Thank you very much about the variant, about this question about variants and the infection, even though it has been seen that the Delta variant has a very high transmission capability as compared to other variants of concern such as Alpha or Gamma. There is still no solid evidence to confirm that in general it is more transmissible and that it is also associated to more severity in young adults or children. The vaccination strategies in most cases gave priority to the vaccination of the elderly, and they are the ones who usually respect social distancing measures the most, as well as physical protection. It is likely that the accumulation of cases in younger population and population that has not even been vaccinated leads to a displacement in the trends of the epidemic. It is also important to mention that social distancing measures are more flexible among the younger population, but I would say that more studies are required at this point in time to determine the actual impact of Delta and other variants on hospitalizations, the severity of the disease, and taking into account also the various age groups. I hope I have addressed the question by the journalist from Mexico. Thank you very much, doctor. Now I would like to give the floor to Manuel Palominos from the AND radio in Chile. So Manuel, can you hear us? Please go ahead.
Sí, ahora.
Please proceed. We cannot hear Manuel. I think there is a problem with his audio, but I have Manuel's question from AND Radio in Chile. He is saying that in Chile, the 80% of the target population has been vaccinated with the full schedule, and this also coincides with an important drop in the number of cases. And the question is, do you think that Chile has reached herd immunity? Dr. Barbosa. Thank you for that question, Manuel. The concept of herd immunity or community immunity is something that is used for vaccine preventable diseases. The most common model, that is the measles model, leads us to say that whenever 45% vaccination is reached among 95% vaccination is reached among children, and if this 95% is randomly assigned in the population, the 95% protects the 5% that has not been vaccinated or the 5% that was vaccinated but did not develop antibodies. And this is how control of transmission is reached. But this may change from one disease to the other and from one vaccine to the other, because this is highly related to the characteristics of the virus and the capacity the vaccine has to protect not only the individual being vaccinated, that is the first positive effect that the vaccine has, that is to say, to protect each individual that is vaccinated. And in the case of COVID-19, that may also imply the difference between life and death of the individual. That is, to be vaccinated is key, but also the higher the number of individuals that is vaccinated, the more progress is made in the control of transmission, together with the continuity of collective protection measures and mask use and others. But in the case of COVID-19, there is no strong and final evidence on the vaccination coverage that could be reached to fully control transmission. Some models referred to 70%, others 85%, and now with the new variants, and also because of some of the characteristics of the vaccines used, some are even talking about 90%. So I do not think that, even though we recognize Chile's efforts and also the excellent result of their vaccination campaign, I don't think it is possible to say this. And first of all, public health measures need to be maintained. Second, there has to be proper monitoring and also identification of the individuals that, in spite of being part of the risk group, are still not vaccinated, to continue with vaccination. And I think that this is key, because here, for example, countries such as Israel, that was the first country to reach this vaccination coverage. After some weeks, they also saw a spike, and the same happened in the United Kingdom. It is very important to continue with vaccination and to maintain public health measures until full control of transmission is attained. Thank you.
Thank you, Doctor. The next questions are related to Nicaragua by Cynthia Torres from El Confidencial. She says the health ministry accumulates 43 weeks reporting one death due to COVID every 7 days. And she wants to know what is the credibility of the statistics from the Ministry of Health in managing the pandemic. And another question is regarding the 200,000 doses of vaccine, Pfizer vaccine, and when they would be arriving in Nicaragua. Dr. Ugarte. Thank you, Sebastian, for sharing those questions. I would like to report once again that unfortunately PAHO does not have enough elements to assess the situation as regards the pandemic in Nicaragua. And in the site where the status is reported for all countries with all the administrative divisions and with trends, etc., there is information about all countries, but Nicaragua is blank. No information. PAHO has requested through the regular channels, through the international health regulations and through other regular channels to obtain this information, and it has not been achieved. So all the authorities and all others who can contribute to decrease the numbers of infections and reduce the numbers of deaths and reduce the impact in the economy, all these measures are welcome. Regarding the arrival of the vaccine in the country, we don't have a time certain or a date certain, but there is all the steps are being followed, which are necessary to ensure the cold chain and then be able to administer the vaccine once it arrives in the country. And PAHO has been working in this with the immunization program. We have a question in English now.
Shown that 2 million people have died of COVID-19 in the Americas so far, and why the region has been impacted so badly. Dr. Etienne?
Oh, thank you for this question. I want to begin first by expressing My sincerest condolences to the families and the loved ones of the 2 million people who have died after being infected by COVID-19. So let me say that there are several important reasons why the Americas has been impacted so badly by this pandemic. First, we know that science matters. Science matters in designing ways to control transmission. Some areas and some countries did not follow the scientific guidance. Some of them are still not taking the appropriate public health measures to control transmission based on the epidemiological situation. Second, Latin America and the Caribbean, as you know, is marked by great inequity with high levels of poverty and a large labor force that works in the informal sector with lack of social protection. Housing conditions in these poor communities are precarious with overcrowding, lack of water and sanitation, among others. If you live in crowded conditions, if you have to work every day to feed your family, if you can't avoid close contact with others, if there's no running water in your house or neighborhood, it's very hard for you to adhere to public health measures that would protect you from this virus. And this is the situation for millions of people in our countries. And this is why we need to support vulnerable populations in these conditions by providing social protection measures now and going forward to ensure access to the social determinants of health. Even before the pandemic, many people had problems with access to healthcare. And this was magnified as health systems reacted and diverted healthcare workers to hospitals to care for those infected with COVID-19. Of course, the other main reason is the lack of access to vaccines. While some countries have immunized over half their populations or more, in Latin America and the Caribbean, only 18% have been protected. We need more vaccines through donations or direct purchases for our countries, and we need it now. One lesson from the pandemic is that health is a fundamental pillar of our societies, but also the economy. A new virus can disrupt our lives very quickly. Hence, we must invest more in health now to combat COVID and to be prepared for the next pandemic. Thank you.
Gracias, doctora Etienne. Próximas preguntas.
Thank you, Dr. Etienne. The next questions are related to third doses of vaccines. Indira Suero from the Institute of Media of the Caribbean, she says that in countries such as Dominican Republic, authorities started to administer a third dose of the vaccine as a booster, and different from the 2 prior doses. And she asks about what is your opinion about this decision. And from Milenio, there is a question about how long does protection last for the vaccines, and should we start evaluating a third dose or booster dose? From NPR in the United States, we have a question in English.
WHO today called for a moratorium on COVID vaccination booster doses until at least the end of September. How much of an impact will this have on the region? Will it help increase access to vaccination in places with low vaccines rates so far? Doctor Barbosa, ¿podría contestar?
Sí, muchas gracias por las preguntas.
Thank you very much for your questions. First of all, let me answer the 2 first questions. And let me take this opportunity to clarify how is it that we make the recommendations regarding vaccines and the vaccination strategies. This is not a decision made by one person in isolation. The World Health Organization has a group of experts from many countries in the world who come together almost on a weekly basis to review all the evidence, collected evidence produced by the studies that are being conducted specifically to determine the duration of immunity when a person is vaccinated and the response to new variants by the vaccines and other variables, but they also review data from real life. Now that we have hundreds of millions of vaccines that have been administered in the world and continue to be administered. So all of this evidence is reviewed quite carefully and thoroughly to determine whether it's necessary to change recommendations, but it is important to wait and have evidence in order to support the decision making. You cannot just start making recommendations without having evidence, because you might then throw into question the credibility of health authorities, and the population will be doubtful as to what they're saying. Is it based on evidence or not? So I think it is very important at a time like this, where we are living through a pandemic, the most important health emergency, public health emergency in a century, to keep being very careful and only adopt recommendations whenever there is evidence that can support that and bear it out. So yes, there is an evaluation and monitoring of all the different evidence, but to this point, to this day, there's no evidence to support recommending to give a third dose. This may change in 2 months. It's not a mistake to change. It is right to change, but whenever you have evidence available. So we need to continue to follow up, to monitor and make a decision when the evidence tells us, yes, okay, now we have scientific evidence that supports the fact that we need a third dose. We don't have it yet. And I switch to English.
That this statement is very well aligned with all the calls that our director, Dr. Carissa Etienne, has made for several weeks now, asking the richest country in the world to share their vaccines through donation. I think that this is clearly making a difference in July, in August, in September, to allow many countries in Latin America and the Caribbean to have more access to vaccine. I think that this statement is important because if we have the countries that purchase more vaccines than they need, using this surplus to have a booster that we don't have the evidence yet, it will be, I think, that not only a public health, but a moral and ethic, very complicated situation. The best way to use this surplus is donating now these doses to allow the countries to progress in the vaccination, to protect their population, to save lives, and progressing together in all the regions of the world to achieve the control of the transmission. Thank you.
Gracias, doctor.
Thank you, doctor. Now the next question. We have a few about the Delta variant. Melina Ochoa from Uno TV in Mexico says, what's the status of Delta variant in Mexico, and what states have more higher rates? And Andres Miranda from Artículo 66, among others, ask for information about the variants of concern which are circulating in Nicaragua, especially Delta, and how is the process of identifying variants in that country? How is that advancing? Dr. Eldigueri. Thank you very much for these questions. We have 2 questions about the Delta variant, but the approach is different. Regarding the questions from Mexico, how have we, or the way we have also said in prior press briefings, Mexico through INDRE has one of the best and sound networks of genomic identification of the region, and it is also one of the reference labs in the region. So with that capacity, INDRE has been able to generate 19,000 sequences and detect almost 15 different variants that have co-circulated in the country, including several variants of interest and 4 variants of concern, alpha beta, delta, and gamma. Taking into consideration information from the last 8 weeks, and it is important to have good coverage in terms of time. Variant Delta with an accumulation of 31% of sequences, especially more during the last week, which is week 27 of follow-up. So Delta has been displacing Alpha, which had 25%, and Gamma, which had 14% of the accumulated sequences. Delta has been observed most widely in Sinaloa, Baja California del Sur, Quintana Roo, Hidalgo, Nuevo León, Mexico State, and Mexico City. So in this context, to conclude regarding Mexico, Mexico maintains active genomic surveillance, which is articulated with the epidemiological surveillance, and then therefore it allows for early monitoring and detection of the unusual increase in cases. Now, regarding the question from Nicaragua about this country, I think it follows to some of the questions of last week during the press briefing. It is important to remember that as part of the technical cooperation by PAHO, PAHO has sent in the necessary inputs and reagents for screening, detection of variants of concern of the virus, not only to Nicaragua, but also to 23 countries and territories in the region. We have regional coverage and sub-regional coverage of these new tools. By today, we have not yet received a report on detection of variants of concern or interest in Nicaragua, but it is important to take some sub-regional perspective and mention that thanks to the samples shared by several countries of Central America, such as Guatemala, Honduras, El Salvador, Costa Rica, and Panama, within the framework of PAHO, we've been able to demonstrate that in the countries of Central America, the variants Alpha and Gamma, which are variants of concern, have been circulating in Central America, and to a lesser proportion, Beta. All of this in Central America and in co-circulation with other variables of interest. Regarding Delta, according to the data available right now in the Central American region, circulation of the Delta variant has been demonstrated only recently in Costa Rica. To conclude, therefore, sustained surveillance will allow us to detect timely the introduction of Delta variant in other countries of Central America and do a close follow-up to its possible dissemination, and therefore recommend strengthening of measures of public health in very specific locations. I hope I have answered the two questions about Mexico and about Nicaragua. Thank you. Thank you, Doctor. Next questions about Venezuela. Gabriel Bastidas from monitoreo.com asks whether there is concern about the impact that the Delta variant may have in the country, given the low level of vaccination so far in the country. And also Violeta Villar and Mariana Soquet from Efectos Cocuyo ask about the arrival of vaccines through the COVAX mechanism to Venezuela. Is there a date and an amount? Will it be just one delivery or several? And also questions about the process of vaccination and PAHO's role in this. Dr. Ogarte, thank you for these questions, Gabriela and Violeta. The Delta variant is a variant of concern, and it has shown significant increase. So detection of the Delta variant in Venezuela is in fact a reason for concern in the country. And we've been working with the Ministry of Health and with the entities responsible for detecting all variants to be able to follow the cases and be able to implement the necessary actions. We are seeing its presence in several states, and therefore measures adopted will have to be adjusted to each one of the different states according to the transmission of this variant. We together, or we are jointly doing surveillance of the health services, and we are increasing our aid to be able to have more supplies so that Venezuela can respond to the pandemic regarding vaccines. COVAX facility has confirmed that during this round of vaccine distribution, Venezuela will be receiving 2.6 million of Sinopharm vaccines and about 600,000 of Sinovac vaccines. These have been authorized by Venezuela, and there is an authorization to import these vaccines. So the authorization is ready. So the revolving fund of PAHO will be able to make the deliveries or the shipments between today and September. Later on, in the next round of shipments, Venezuela would receive additional Sinopharm to complete up to 5 million doses of this vaccine. Thank you. Thank you very much, Doctor. Next question is by Royston Jones from Bahamas in English.
Or has considered mandatory vaccination for healthcare workers, given their increased risk of infection, severe symptom, and death? Dr. Barbosa?
Thank you for this question. You know that the national laws are very different in each country, so PAHO is not making recommendation about the voluntary or mandatory vaccines for any groups. But let's remember why health workers were the first group to be prioritized in any national plan, because the PAHO and WHO clearly recommended that the healthcare workers should be the first to be vaccinated for two reasons. The first one, healthcare workers were more exposed to the risk, so we needed to protect them to keep the health services running. But there is also a second reason, that the healthcare worker that is not vaccinated can be not only can get the infection, but also can transmit more easily the virus to the patients that are going to healthcare facilities. So it's very important that the healthcare workers can be protected and need to protect also the patients that they are providing care. I think that and you know that there are some doubts and some concerns among healthcare workers. We performed a survey among the Caribbean countries, and we are supporting the Ministries of Health in the Caribbean countries to address the questions, the doubts that the healthcare workers have in order to get them fully vaccinated. I think that this is really very important, and it's important also to listen them, to establish a dialogue, to mobilize the nursery and physicians associations, to mobilize the vaccination specialists in each country, to have an open dialogue and to have all the healthcare workers protected through the vaccine. This is very important to keep the services running, hospitals, ICU, primary healthcare facilities, but also to protect the people that go to a healthcare facility to get immunization, prenatal care, a surgery, a cancer diagnosis, a hypertension and diabetes diagnosis and control. So it's very important to address this issue and to increase the vaccination among the healthcare workers. Thank you.
Gracias, doctor. La próxima pregunta de Gerson Collave.
Thank you, Doctor. From Gerson Collave from El Comercio in Peru. It says, in Peru, the cases of people in ICUs are happening mostly in non-vaccinated people or people who have received just one dose. Is this true for other countries in the region? Dr. Aldigueri, thank you very much for your question. Yes, it is a common scenario repeated in some countries in the region, but it is important to emphasize that what we have said already, I repeat, we should stress that there are very large differences in terms of vaccination coverage among the countries in the region, with less than 10% in some countries in Central America and more than 60% in other countries, as some countries in the Southern Cone regarding patients in this scenario, even though people who are vaccinated can become infected, infections are usually asymptomatic or they usually have mild symptoms. So in this context, as long as there is a significant proportion of non-vaccinated people or people who are just partially vaccinated, these people will have a higher risk of suffering severe disease and to require management in ICUs. So hence the importance of giving full vaccination in the whole of the population. I hope I have answered your question. Thank you. Thank you, doctor. And as a follow-up, the same journalist asked, in recent days, they have started to vaccinate people 40 years of age, but some people are rejecting Sinopharm and they want Pfizer because there was a misinformation campaign. So it has this been seen in other countries, and how can we improve the situation? Dr. Barbosa, yes, thank you. The topic of communications is key for the success of vaccination campaigns. The Pan American Health Organization is working from the beginning with the countries to establish, review, make recommendations to improve national plans of immunization. And one of the key topics is that of communication. Choosing the vaccine you want entails a double risk. First of all, the person may be left without the necessary protection. Maybe within 2-3 more weeks, you don't know when you will be able to get the second dose. Then person can contract the disease and be very serious and die. So we really cannot be making these kinds of decisions that make endanger your life, given some information that is shared through social media based on false information. Vaccines have different performances for the phase 3 trials for effectiveness because they were run in different countries at different times when there was more or less transmission, etc. But when we take a look at the real life data, all vaccines that have had the emergency use license from WHO have at least 80% protection for severe forms of the disease. So if you have the opportunity to reduce the likelihood of having severe disease or die by 80%, I think people should not make a bad decision, the wrong decision, which might affect their lives and that of their family. So it's very important that everyone receives the information, accurate information, as our director, Dr. Etienne has mentioned before, the best vaccine is the vaccine that is available to you. Please don't have doubts. Don't question the vaccine that you are receiving. All those vaccines that have been granted the EUL are safe and effective. Thank you, doctor. Next question is from Adriana Brasileiro from Miami Herald in English.
Reporting daily record highs in COVID-19 cases for the past month. Why did it get to this point, and how can Cuba turn things around? Dr. Ugarte?
Muchas gracias por la pregunta. El turismo, hemos sido informados que el turismo en Cuba se abrió en determinados.
Thank you for your question. Yes, tourism was opened and some contention measures and surveillance measures were applied. However, mass tourism has been closed in Cuba, so the areas that were open, Varadero and Escayo, the situation of the pandemic in Cuba, however, continues to be concerning. During the epidemiological weeks 90 and 30, which are the most recent weeks, the last 2 weeks in July, there are confirmed cases. In week 29, they had reported 51,081 cases, an increase of 21% with respect to the prior week, and the last week, 61,375 cases, an additional increase of 16%. And therefore, we are still in a very active phase of transmission. And related to tourism, one of the provinces showing a decrease in the number of cases was Matanzas, with a reduction of 41% of cases, and the Isla Juventud municipality with a decrease of 7%. These are the provinces and the municipality where the cases were reduced. The rest, they all increased in the last 14 days. The province with Apremisa, almost 60% increase. Cienfuegos, also Havana with more than 50% of increase. Guantánamo, Ciego de Ávila, Holguín. In other words, the situation is complicated in Cuba. And this, as I said, given the Delta variant, which has been reported by several authorities in different parts of the country. And so there is a very hard economic situation in Cuba as well. There are long lines to obtain food, and there is exhaustion from the population given the measures that have been adopted to protect them from the pandemic. However, there are some positive signs. Increase in vaccination in Cuba is an increase which is quite significant in many places, and we hope that it continues to be so in order to reduce the number of deaths and serious cases. The impact would be worse if early vaccination hadn't started, especially for health workers and in risky areas such as Havana. We therefore are supporting not only to respond to COVID-19, but also within the humanitarian context by sending supplies for the first and second levels of care and be able to somewhat compensate in the response of COVID-19, which has demanded a great deal of personal protection equipment and other supplies. Thank you. Thank you, Doctor. We're coming to the end of our session, and we still have several questions related to the Delta variant.
Trinidad y Tobago en inglés dice, can you provide an update on the Delta variant, particularly in the Caribbean? Has there been any community spread or new clusters detected anywhere? En Melina Ochoa de UNO TV en México también pregunta.
And Melina Ochoa from UNO TV Mexico.
Is more dangerous, and would it change the rules of vaccination? Doctora Etienne.
So let me thank Kevin, Jesse for those questions, and let me put this in perspective. Viruses have one goal: to multiply and to survive. So they adapt to become more contagious over time. And that's what we are seeing with the SARS-CoV-2 virus that causes COVID-19. The Delta variant spreads more easily, so it is driving new infections and in some cases reinfections in our region and around the world. So as of August 2nd, 22 countries in our region have detected the presence of the Delta variant, including 10 countries and territories in the Caribbean. Many of these detections were associated with travelers. We are seeing community transmission of the Delta variant in Ecuador, Mexico, and the United States of America. PAHO has supported the countries through its regional genomic surveillance network, which helped 49 countries and territories in our region to detect variants of concerns that are now referred to as alpha, beta, gamma, and delta. So this is concerning because cases seem to spread more easily with the delta variant. So we really cannot afford to let our guard down. According to the evidence available so far, all of the vaccines that have been licensed by WHO protect against all the variants, including Delta, and they significantly decrease the risk of hospitalization and death. So they continue to be a powerful tool to fight the virus, and thank goodness. That is why we need more vaccines now for Latin America and the Caribbean. And this is why we call on all countries to donate any available vaccines to our countries. Nevertheless, we know that none of the vaccines is 100% effective. So some very low level of infection is expected in vaccinated persons, not only with Delta, but with any other variant. But usually, those who are vaccinated, who become infected, do not suffer generally severe illness or admission to ICU. I continue to reiterate, to stress that the best way to stop the virus, regardless of the variant, is to reinforce the public health measures, including appropriate use of masks, social distancing, isolation of patients, quarantine of contacts, and yes, vaccination. All of these measures are demonstrated to be effective at stopping transmission and should be maintained even in vaccinated individuals. Our recommendation on vaccines remains the same. When it is your turn, get the COVID-19 vaccine to protect yourself against severe disease and death. Vaccinations are the way out of this pandemic, accompanied by the other public health measures. Thank you and have a wonderful day.
Muchas gracias, doctora Etienne. Ahora sí,
Thank you very much, Dr. Etienne. Now we have reached the end of this press briefing today. Please remember that you can find more information on COVID-19 and the regional situation on PAHO's web, www.paho.org.